Hi, my name is Brandy Matus, and I'm the Director of Food Nutrition at Medical City Denton. And today we are going to talk about the renal diet. Let's start with our mission and patient promise. Above all else, I am committed to the care and improvement of human life, and I am committed to excellence always, every action, every patient, every time. So, what is a renal diet? In general, a renal diet is a diet that is low in sodium, potassium, and phosphorus, and it might be coupled with a fluid restriction at times. Patients who need to be on a renal diet are those that may have chronic renal disease or kidney disease at multiple stages. They could have an acute renal disease, such as a renal injury or failure, patients on dialysis, or patients with high blood levels of phosphorus or potassium not due to renal impairment. They just have elevated levels of potassium and phosphorus in their blood. So, why do patients need to be on this diet? Patients with compromised kidney function struggle to filter waste from the body. So, as a result, these electrolytes, such as potassium and phosphorus, become elevated. Consuming too much sodium can also cause the kidneys to dysfunction as well. So let's break it down and talk about sodium. Sodium is a mineral, and we mainly consume sodium when we eat salt. Foods made with little or no salt are typically low in sodium, and a low sodium food is a food that contains less than 140 milligrams of sodium per serving. And this information can be found on the nutrition facts label of individual food products as well. Foods that are typically high in sodium and not served on our renal menu are salt, all forms, table, kosher, pink, regular deli or processed meats, breakfast meats such as bacon, sausage, turkey, bacon. We allow one slice per day. Potato chips, except for sun chips, salted crackers, soft cheeses and cheese sauce, except for Swiss cheeses, soy sauce, regular gravies, regular soups, pickles, and certain desserts, fast food meals, including shakes, and TV dinners, convenient food items. All these foods typically contain a lot of sodium in them. So, foods that are low in sodium that we do serve on our renal menu are Mrs. Dash, which is a salt substitute, low sodium deli meats, one slice of bacon, like I mentioned before, or turkey sausage, sun chips, unsalted crackers, Swiss cheese, low sodium soups or broths, low sodium gravies, yogurt, we do one per day, and I'll talk about that later with phosphorus, all fresh fruits, excluding melons and bananas due to potassium. We'll talk about that later as well. Um, Fresh or cooked unsalted vegetables, meats cooked with little salt, most breads, rice, mustard, and pepper. So these are things that they're allowed to have on their diet. Potassium is an electrolyte, and it can build up in the blood in patients with end-stage renal disease. This is called hyperkalemia. It is very dangerous and can cause an irregular heartbeat, leading to a possible heart attack. Treatment for high potassium in the blood is most commonly by the diet restriction of potassium, or certain medications can help. Most foods restricted on the renal diet are high potassium. So here are some foods that are high in potassium that we typically do not serve on our diet, the renal diet. Melons, bananas, oranges, orange juice, tomatoes, any tomato product, potatoes, we allow one serving, avocado, bran cereal, beans, prune juice, nuts, peanut butter, and raisins, all high in potassium. Low in potassium foods that we do serve quite a bit of is white bread, Swiss cheese, rice, all berries, apples, grapes, peaches, pears, plain cooked pasta, hummus, apple juice, oils, and fats. Phosphorus is also an electrolyte. Phosphorus can build up in the blood in patients with end-stage renal disease. It is called hyperphosphatemia. High phosphorus in the blood can be treated by either a diet low in phosphorus or phosphorus binders. Here are foods that are high in phosphorus and not served on our renal diet. ice cream, milk, and yogurt. Both are allowed on the diet, but we limit it to 1 serving per day. Cheese, only Swiss cheese is allowed. Oatmeal, dark sodas such as colas, chocolate, and wheat bread all have phosphorus levels in it that are high. Foods that are low in phosphorus and we do serve on our menu are cream of wheat, fresh fruits, excluding bananas and melons due to the high potassium content, most vegetables except for potatoes, white bread, most beverages, rice, and corn. I think really the only beverages we exclude are the colas. Just some additional information to reinforce some things we said in previous slides. To remember that milk products and potatoes are only allowed once per day. We offer these items as they are common food items that most people enjoy, but they are both high in potassium and or phosphorus, so we just do 1 serving. Note that not all foods were mentioned in this presentation. The main focus was on foods currently on our renal menu. So any questions regarding a food not listed in the PowerPoint, please contact myself or one of the clinical dietitians. Thank you. So this includes our renal diet presentation. There will be a competency assessment that concludes this that I will send the link out to. If you're ever in question about a food that is high in sodium, potassium, or phosphorus, we do also have reference guides in our reference book and the diet office. And of course, you can ask myself or any of the dietitians as well. Thank you and have a great day.